It's the most tragic scenario. In Africa, where Ebola is raging out of control and medical professionals can no longer stem the tide. It's unimaginable that this could actually happen. But given the recent outbreaks in West Africa, it's an all too real possibility. Ebola first emerged in Africa in 1976, and since then there has been about 30 outbreaks. Many occurred in remote villages in Africa. But the current outbreak in West Africa is the largest and most deadly since the virus was discovered.
So clearly the epidemic is quite large when compared to previous epidemics or outbreaks. And so as far as the reason for that, there are a number of contributing factors. The area of where the epidemic is occurring has never before seen the virus, and so the people in that region don't have pre-existing immunity.
By summer 2014, the World Health Organization declared the epidemic an international health emergency. Days after that declaration, the President committed resources from the Department of Defense and Uniformed Services to help bring the epidemic under control. DITRA worked closely with its interagency partners and used existing agreements with the Centers for Disease Control in order to make clear delineations on the lines of effort and funding for national and global health security.
Some folks inside of DITRA SEC started noticing this Ebola outbreak in West Africa was a lot different than previous outbreaks, and that it had significant implications for national security, and that we didn't see that it was doing nothing but exponentially growing.
In the late July frame, we actually stood up a regional contingency team to deal with this in a more urgent manner.
Just like any wicked problem, Ebola is not going to be solved by, one silver bullet. It's going to require multiple lines of effort to attack the problem. And so that's kind of the beauty of DITRA, is we have multiple skills and experiences and abilities to do that.
And a key part of this Operation United Assistant effort comes through the DITRA CTR program, through the Cooperative Biological Engagement component, where CBEP has actually deployed mobile diagnostic labs to Liberia and then subsequently now to Sierra Leone. And they play a really key part in making sure that we know who has Ebola on the ground and who doesn't, and who needs to be treated effectively. It's made a huge difference.
Early on in the Ebola outbreak response, Sierra Leone labs asked if we could support them with diagnostic capability and some training from some of the initial first cases that they were seeing coming through the door. And then our role expanded to help provide personal protective equipment to the country as a result of a direct request from the country government there and our U.S. Embassy.
Far ahead of the outbreak, DITRA SCC invested research dollars to develop medical countermeasures for hemorrhagic fever viruses, including Ebola.
Nobody else was really focused on Ebola except us before this current outbreak.
As far as why we're investing in them, if you look at the viruses themselves, they exhibit a number of characteristics that make them of concern. For instance, the ability to cause very severe infections, the lack of effective countermeasures, so vaccines and therapeutics for these viruses. After Doctors Without Borders declared the situation in West Africa to be out of control, a group from Health and Human Services, along with the DoD, met to assess all of the countermeasures, so vaccines and drugs, that are in development for Ebola within the U.S. government. The group made recommendations to accelerate the product development for 3 countermeasures. 2 out of 3 of those are currently in development within the agency.
We've been doing modeling analysis since probably May of 2014, only a couple months after the outbreak started, so well before anybody was really paying attention to it. And those products that we produced have significantly impacted decisions that were made on force structure that was sent over there, about the number of beds that might be needed, about the number of laboratories that might be needed.
As U.S. troops deployed to West Africa for Operation United Assistance, the United States Transportation Command realized there was no way for the Department of Defense to move multiple patients infected by this highly contagious disease at the same time.
DITRA received a joint urgent operational need from the joint staff to work with Transcom to fill a capability that did not exist in the DoD. So for any kind of dangerous pathogen or condition where you need to keep somebody isolated and keep the plane secure and clear of the Ebola in this case.
While visiting Liberia last fall, Chelsea Goldstein visited an Ebola treatment unit in Bong.
That really hit it home for me, that anything that we can do on the ground to help identify the virus earlier, get people treatment faster, eventually, ideally, develop vaccines and therapeutics so that people aren't as sick anymore. I mean, it makes a huge difference.
Folks should remember, after everyone cleans up, packs up, and goes home, we're going to be there for the long haul to build out a national capability and capacity for most of these countries so that in the future, should they face a similar outbreak, they'll be better equipped to handle it on their own and to mitigate it as early as possible so we wouldn't see such a large spike in cases as we did during this outbreak.
I absolutely think the Department of Defense efforts on the ground have made a huge difference in stemming the tide.